once you provide accessibility and you provide affordability, then definitely you will see the healthcare improve, because your citizens will now definitely come out and begin to use the facility. Under the wrong assumption we used to have that by just putting the buildings there, people would use them. I think you've shown that no, there must be some incentive, and that is what is happening in Ogun State. I commend you for that. On this note, I will call on the governor of Lagos State to speak to us and to respect the. You have 10 minutes. I gave you 3 extra minutes. Because I'm biased. We have things he can do.
The reason I have 10 minutes is because you are a first-time governor. He's a first-time governor, so I'm outgoing. Distinguished ladies and gentlemen, I think first it is important that our forum is discussing these issues as a way of at least communicating to Nigerians from across our country that some things are happening for good, in a way to inspire our minds to begin to see some of the better stories across what I believe is a truly beautiful country. Now, why are governors even discussing about health care? Why is this not a meeting of doctors? It's because constitutionally we have responsibility for the protection of life and property. And the protection of life does not start and end with the existence of coercive authority of police and all of those institutions, but indeed the preservation of life is the fundamental for me of the protection of life and securing our people's well-being. So that's where I want to start my engagement from this morning. You will hear across the states the number of public facilities, the investments that have been made in hospitals and all of that. But I don't think that I would be useful here by continuing along those lines. I think the discussion about primary health is all very good. It's the foundational system. But when we talk about the facilities, it perhaps strikes me that we have left something more profound behind in the discussion. It sounds like police officers coming to tell us how many robbers and criminals they have arrested, and perhaps when we would, in that sense, be more concerned and should be more concerned about ensuring that there is no crime at all. So, for me, it is how to prevent people from being ill that must really be the real and the big picture. Securing people's well-being as a way for preventing them from falling ill and securing a longer life expectancy for our people. So I think the best healthcare system must be one that prevents. The primary healthcare system will help, but I think what will help more is the environment, the provision of water, the management and sanitation of the environment, prevention of diseases that are vector-borne, like malaria, laryngeal spraying, indoor residual spraying, and so on and so forth. And this is happening, I must say, in a number of states across the country, including Lagos and Rivers, at least that I can speak about, given the deep engagements that I've had with the governor of Rivers State. Also, screening. And in Lagos, we spend quite some time moving from local government to local government. ensuring that people are screened, blood samples, body samples are taken to ensure early detection of life-threatening diseases. Many of them might be inspired to come into hospitals by cash grants and conditional cash grants initiatives, some of which my colleague in Ogun has alluded to. But what we have done at home is to take the healthcare into the communities. And we move from local government to local government, screening for high blood pressure, diabetes, HIV/AIDS, tuberculosis, and so on and so forth. And I think that these are some of the things. Then, of course, immunization, our polio challenges. Now, but again, we are addressing polio, for example, from immunization very aggressively. But I think we should pay more attention to lifestyle choices that we make that predisposes people to contacting these diseases. Hygiene, open defecation, and open urination. It is clear to, and I say this with respect to our very eminent practitioners, the virus itself is born from flies and stuff mixing with human waste and passing it through the alimentary canal into the intestine. And these are changes that I believe that the chairman of session has, that members of the public, those we lead, also have a responsibility. No matter how much vaccine we buy for polio, if people continue to defecate in public and children go and play football and they don't know what has happened, and so on and so forth. But let me continue in my advocacy for prevention, nutrition. So, well-being. If we are dependent on imported food, can we really aspire to a healthy nation if nutrition is insufficient and deficient either in quantity and in quality? Education, primary education, knowledge and information about choices that we should make as a people. The necessity for continuous hand washing as a basic of life to prevent disease and infection. Child spacing. We're talking about people, losing their lives, and we are reacting. All of us, including me, are reacting at the level where we are providing antenatal care, maternal care, but there are different types of pregnancies, and we must understand that. There are low-risk pregnancies, there are very high-risk pregnancies. Why should a 50-year-old or 40-year-old woman be going through the choice of having the sixth child simply because her husband wants a male child? And that woman bears the burden because of the lack of knowledge that there's nothing she can do if her husband fails to release the Y chromosome, because she has only X chromosomes to produce. And it is this knowledge, really, that will help us prevent deaths and ill health occurring from that specter of ill health and threats to well-being. Child spacing also, and to understand that every time that we indulge in perhaps what the last presenter called leaving good behind and focusing on the behind, that it must not necessarily, I call it ensuring that you fire blanks, either by doing the appropriate thing or, because these things have consequences. And if the 2/3 of the world really is living in poverty, then we must make some choices about slowing down the rate at which more people come into a world that is dominated by poor people. And there's not going to be any magic there. No governor will come into people's houses and say, look, listen, you know what? You can't have more than one child. It is a matter of discipline and common sense as a member of a total community to say, look, I can look after 5 children. I will make 5 children. And, so going forward, therefore, lifestyle, obesity, I eat, a choice of meat, fish, and everything at night, and so on and so forth. But Beyond that, we have made progress in terms of our curative health. There's a lot going on in the states. The hospitals are there, but are the healthcare workers sufficiently mentally disposed to treating or caring? And there's a big difference between the two. Insurance access, I could go on, and of course, developmental health, research. One of the things we're doing now is that from our primary healthcare initiatives in Lagos, we found an unusual prevalence of goiter in a part of Lagos. And we have set a research team in there while we are addressing the curative level, but we are trying to find out what exactly is causing it. Is it iodine deficiency specifically, or some particular problem peculiar to that area? Distinguished ladies and gentlemen, my time is done. Governor of Ogun says I have used 12 minutes.